Hi, Dr. Drummond. Thank you for letting my dad do his report on video because it's his first day of work tomorrow.
Okay. Jeff Pettis' research proposal. Nursing 559. What I wanted to first say is I picked humor because Dr. Drummond had mentioned in our last class that there has to be passion involved, or it helps to have passion regarding our research, because it's going to be a long, slog, and it'll be a kind of a more of a task if we don't. So what I did is, I've always been told I have a sense of humor, and as you guys know, it's been a blessing, and also it can have its consequences too. But it's been helpful in my clinical practice and stuff in clinical. So I decided to go ahead, as you can see here, to explore humor as it relates to health. And I just ran across a passage in the Bible that says, "A merry heart doeth good like medicine, but a downcast spirit drieth up the bones." That's Proverbs 17:22. I thought that was fitting. Just introducing it, science is beginning to prove what many people have known all along, that indeed laughter is good medicine. Humor and laughter enhance positive feelings and emotions to balance the preponderance of negative emotions that surface during stressful times. Humor and laughter appear to have many healing qualities. So we've known that, and this leads to my research. And is there any validity to that in the clinical setting is going to be the focus. In terms of a problem statement, this is my first crack at this, so some of these things I had to struggle to understand a little bit, but what I came up with is that despite the widely accepted notion that humor plays an important role in the healing process, this aspect of treatment has not gained wide acceptance in mainstream medicine. As we know, doctors are, they think in terms of algorithms. Sometimes they're slow to adopt things that they can't put empirical evidence to, or can't use quantitative data to prove out. It says here that some medical professionals have contended that the use of humor as a beneficial tool to aid in a patient's healing is trivial and untested myth. And those are my words. I run across that personally, in that doctors aren't embracing that. So the purpose of this study is to investigate the role of a caregiver's sense of humor, how the role of a caregiver's sense of humor can play in the healing process within the clinical environment. So when we're thinking about purpose in the instructions and reading in the book, you have to come up with a question. Hopefully the research study is going to answer some a hypothesis or a clinical question. My question is, does humor have a positive impact on health outcomes? So can we actually measure that? Can we actually do research? Can we actually show that to be true? Literature review, again, this is I started out by, I found 9 or 10 solid, studies on Cinol and some other sources, and I just started printing them out and looking at the book, and I in this, for our purposes in this assignment, I started off thinking I'm going to have to come up with some sort of an annotated bibliography, and I quickly learned that that's not the case. What I try to do is look at it as a whole, what the research that I gathered, and see what the common themes were. And what I noticed, and this just from my own perspective, is there are numerous bodies of research exist that examine human relation to health. There's a lot of stuff out there on this subject. There are many broad claims, but documentation of empirical evidence is in its infancy, meaning there's a lot of, we'll get to theory in a little bit, but there's a lot of claims made, and sometimes this is how this quantitative stuff or qualitative stuff goes, but there's not a lot of actual empirical evidence. We're starting to get better, but therein lies why it's important that I'm doing this, because more research needs to be done. Research Documenting benefits in specific clinical populations is needed. So there seems to be, there's some on cancer, things like that, cancer patients, but how does humor affect certain specific populations? That's an opportunity area. Theoretical framework. This is another one that took some thought, and this is more difficult than I anticipated, and I'm hoping I'm on the right track here, but I think that's why we're doing this assignment, is to get some feedback on that. The most of the research I've done, and what I can see, for the most part, it's not true across the board, but bear with me on the pronunciation of this, but and this is the kind of what I'm going with myself is a phenomenological approach. And this is a qualitative study, so it would be a phenomenological approach to qualitative study. So according to our text, phenomenologists view the person as integrated with the environment. Now, that immediately sounded familiar to me, so we can kind of see where this is going. The question phenomenologists ask, the broad overreaching question is, what is the meaning of one's lived experience? It's even starting to make more sense. Or sound more familiar. The researcher must interpret the explanation provided by those studies. So this is going to be a qualitative study. We're going to look at a body of research, and as the researchers I've been studying, what I'm going to be doing is we're going to be making inferences out of what we learn versus putting numbers to each fact, or we're not going to be doing a quantitative study. We'll be looking surely at data, or solely at data. A theoretical example, and this is funny because I found this after I had decided to do phenomenological study, but Dr. Parsi has a journal in Sage Pub, or Nursing Science Quarterly. It's The Experience of Laughter, a Phenomenological Study. And this is a quote that came out of her piece. I didn't have access, I couldn't find it in CINAHL, but I found part of it. Laughing is buoyant immersion in the presence of unanticipated glimpsings, prompting harmonious integrity which surfaces anew through contemplative visioning. This definition is congruent with some of the current literature and practices related to laughter and health. So I'm going to be using a Parsi guide. I'm using Parsi as kind of an overall theoretical guide for my paper and my research. Sampling. Again, this was a tough one. One thing I struggle with, I don't know about you guys in the class, but okay, I'm not doing the research, so I'm not going to, at least yet, I'm not going to be deciding exactly who I'm going to be sampling. I'm not even sure. So what I had to do is look at the literature as a whole and decide are there consistencies in the sampling that has been done in the research I'm going to be studying. In terms of, there's inclusion and exclusion. Those are two of the main categories in terms of sampling. In terms of inclusion, I noticed that they're normally looking at the professional caregivers. Specifically, when I say professional, I mean like RN, MD, in terms of the who's going to be actually doing, the clinical practice on the folks we're going to be studying, and then there's the clients in clinical settings who are receiving the care. So it's going to be professional caregivers and actual clients in the clinical setting. Exclusion, the people we don't want to be looking at, because we need to stay narrow and focused, would be non-professional folks doing implementations, such as CNAs, volunteers, other people that might be in the hospital or acute care setting. They will be excluded for being considered in this research. And also there's likely to be family and friends of the client around those that will be studied. Their opinions on humor and manifestation of it will not be included. Data collection. What I could tell, and again, this is my first crack at sifting through all this stuff, but interviews are most often used for data collection from the caregiver perspective. So it'll be the RNs, the MDs. Most of these studies, they were interviews conducted on these folks. To use a term that I found in the book, but also I found it in the literature, is that the idea of ethnographic study. This is often the means of data collection for the client side in the clinical setting. And what is an ethnographic study? It's firsthand observation of the daily participation. So, for example, the interviews will be interviews with RNs and MDs, but in terms of gauging how humor, hopefully gauging how humor impacts positive health outcomes, we're going to be observing, we're going to go ahead and somehow, how it differs depending on the study, how we introduce humor. But after it's introduced, we're going to be, like in a longitudinal type study, we'll be observing how the clients respond to that over time. So that's what we mean in terms of ethnographic study. Protection of human participants. That's an important thing. At first I thought it didn't really apply here, but of course it does. These are my words, the mechanism of human delivery. That's an important consideration here. So if we're introducing humor, we have to be careful not to use sarcasm as a means of humor, because oftentimes, almost always, sarcasm has an aggressive, motive-driven quality to it, and we're not interested in that. And when we're being humorous, we have to be sensitive to race, culture, gender, religion, and sexual orientation. There's, oftentimes we use racist jokes or even jokes that have veiled humor. We have to steer away from that. Why? Because this type of humor tends to isolate or exclude people, and that's the opposite of what we're trying to achieve here. We want an encompassing type of humor that can be shared across the board. And of course, to know the appropriate time and place, because especially in the healthcare environment, there's sensitive times. We're dealing with death, we're dealing with sickness, we're dealing with grieving. So there's definitely, I know, and you guys can certainly attest, that there are inappropriate times to use humor. So this is another theme of this whole thing, is it's a balancing act. So we have to be careful how we look at the mechanism of humor delivery. That's it, guys, and I am hoping this video went over well and you could see. If not, you could at least hear what I was covering off. And once again, thanks a lot for letting me do this. I am going to Four Seasons Surgery Center tomorrow at 6:30 in the morning, and you guys have a good day.